Hello, my name is Dr. John Heyer. I'm a holistic chiropractor in Frankfort, Illinois. The topic for today's video is neck pain as a result due to a motor vehicle crash. This is a topic that's very near and dear to my heart for a couple of reasons. First of all, as a practicing chiropractor for over 12 years, I've seen hundreds of people who've been in car accidents and had different pains, from neck pain to headaches to lower back pain to a number of different types of conditions. So I've seen a lot of these types of problems in the office. I also have some additional education and background in motor vehicle crashes, especially low-speed rear impact collisions. And the third reason why this is a near and dear topic to my heart is because I too am a victim of a low-speed rear impact collision. In November of 2008, I was rear-ended at a stop sign, and after that I started experiencing headaches, neck pain, and other discomfort that fortunately through holistic chiropractic treatment, has resolved, and I no longer suffer from those issues. But the topic that I want to talk about today in particular is the misunderstanding, the myth that, well, you know what, if there's no crush to the vehicle, then there can't be a problem to the person inside. And that's not necessarily true. And here's why. You see this blue car and this red car, excuse me, I'm going to come over here. Let's pretend that this blue car is stopped at a stoplight or a stop sign. It only takes 5 miles per hour of this red car to impact this blue car. Research has shown that that low speed of an impact may not actually cause damage to that bumper. You may not actually be able to see a ding. Some cars have dampeners and some cars have foam that is supposed to absorb the impact but doesn't necessarily do that. So this impact can affect the person sitting inside that car. And the term that we used to hear about whiplash is basically where the head is whipping forward and backward. Now we don't use that term anymore. We call it cervical acceleration and deceleration because that's what's really happening in the neck. Now, for example, if we were to take an x-ray of a normal looking neck, we would see a curvature that looks like a banana. And it should have anywhere from 35 to 45 degrees of a curve. Now, after a low speed impact, after a collision, such as the red car hitting the blue car, this normal curve could actually be straightened in a person. And in some extreme cases, the neck could actually bend forward in a way it's not supposed to. And if you look over here, we'll show you an example of a normal neck. This is actually a 45-degree curve in this x-ray of a neck. Textbook normal. Nice space between the bones, good curve. And then we have an x-ray of somebody else who has had an injury. You'll note that not only has her spine straightened out, but it's actually crooked forward in a very abnormal way. The space between the bones has decreased, and you can see bone spur formation. So this tells me this was an old, long-standing injury that was never resolved. Yes, this person was suffering from headaches and neck pain among a number of other symptoms, but this is what happens if an injury isn't properly looked at or taken care of after an accident. So, in today's video, what I really wanted to stress was just because there isn't any physical damage or there's no apparent crush to the vehicle, doesn't mean that there can't be an injury or a problem to the occupant. I know, I was a victim myself. So if you or someone you know is suffering from headaches, neck pain, or some type of other symptom due to a car collision or an accident, please pass this website or pass this video on to them and let them know that we can help. If you look over to your right, you should see a phone number for our office. You may even find a website address or an email. Feel free to contact us, and if we can help you, we'd be happy to help you out. Thank you.